Hi, my name is Julia Wolf, and I will be doing my presentation on the National Health Interview Survey. So, what is it? The National Health Interview Survey is specific to the United States, and it is described as a multi-purpose health survey of civilian, non-institutionalized household populations. This includes women and men, children and adults. Um, the way that children are surveyed is a little bit different than adults, but they are both included. It started like the creation of it happened in 1956 and was ran by the National Center for Health Statistics, which is like a subsect of the CDC. And it was kind of written into law by Eisenhower because he and Congress found that relevant characteristics of persons in the country suffering from certain diseases or conditions were not there were no accurate records of those things, and some of the ones that are specifically noted in that in the lawmaking for the National Health Institute survey or interview survey, they mentioned heart disease, cancer, diabetes, arthritis, rheumatism, other diseases, injuries, handicapping conditions. So there was no like accurate count of these things, and those who are tracking disease or tracking different important things relating to health and how we can better the health in our country wanted to learn more about these things and have more of an accurate representation of the population as a whole. So some of the things that the survey specifically has inventories on are the appraisal of the true state of health of the U.S. population, which honestly is kind of hard to quantify, but when you have a bunch of different factors, you can kind of gander at how healthy our country is. Then also adequate planning of any programs to improve said health. So like if there's a really, having kind of statistics on things like those chronic diseases mentioned before can help be like, okay, we need to invest more money in cancer. We need to invest more money in like insulin and for diabetes. And then another thing that the survey does is it helps with research in the field of chronic disease and helps like create funding for that, and then measurement of the number of persons in working ages, so disabled as to be unable to perform gainful work. So kind of understanding how many people do need explicit like public services to help because they're unable to support themselves financially because of physical or mental ailments. So how the NHIS is the data is collected is through a cross-sectional household interview survey, and it's collected continuously throughout the year. And recently they kind of changed it so that it's collected over a couple of years, so that if there's inconsistencies or incongruencies with the data, that they don't have to just throw it out. So they kind of continue to collect the data even after the year is over. The sample drawn by the NHIS is distributed along all 50 states and the District of Columbia, approximately proportional to the population of that like area. So rural areas have maybe less representation, or like it's more equal because they have less people there. So and then the sample design follows a probability design that permits the representative sampling of households and certain groups quarters. And then yeah, it's been redesigned every 10 years, and that's not necessarily like a guideline. Like they can change it earlier than that, but like at least every 10 years. They want to redesign it so that it's more accurate to capturing the health and wellness of Americans, and kind of trying to figure out what needs to be intervened with more. So the survey was altered in 1997 and then again in 2019, and these changes were made to increase relevance of the questions asked, enhance the quality of data gathered, and minimize respondent burdens or inaccessibility. I would say in between 1997 and 2019, there were probably a lot of different health changes, especially when you consider obviously the growing rise of technology and how much it is involved in our everyday lives, and especially like social platforms, and how they affect our health. I think is going to be a growing relevant concern that wasn't necessarily as problematic as it is now. But the 2019 change included a redesigned questionnaire and survey structure. One sample adult aged 18 years or older and one sample child 17 or younger are selected randomly from each household following a screening that identifies just like demographics like age, sex, race, ethnicity, and then the data is collected and weighed to produce national estimates using several different components, including the reciprocal probability of selection, household, and person level non-response adjustments. So it's kind of just trying to make it as equal and like as evenly distributed as possible based on demographics. And I know that as technology has advanced since like the 50s, there has been more like automated aspects of the survey that didn't exist before, to kind of try to help create like an equal data set, and avoid bias and stuff like that. Yeah. So an estimated 27,000 sample adult and 9,000 sample child interviews are expected to be available annually. And analysis in 2019, for analysis in the 2019 NHIS. So the redesign allows for data users to pool 2 or more years of sample if needed to reproduce reliable estimates. So into the like meat and potatoes, the actual content of the survey consists of 4 components, which include the annual core, rotating core, sponsored content, and emerging content. So the annual core is the questions that are often recurring and stay the same mostly, even with changes. And they focus on demographic characteristics, health insurance, chronic conditions, healthcare access and use, health-related behaviors, and functioning and disability. So basic, just like how are you doing, are you taking care of yourself? Rotating core, this consists of more these are more like period questions, and they have expanded content on mental health, service utilization, preventative services, health-related behaviors, injuries, and chronic pain. Sponsored content is funded usually by other federal agencies with clear understandings of certain areas of health, whereas like the organization, I think it's the HHS and the CDC, like they are more broad and might not know more of the specificities that need to be known in certain health areas. So those sponsored content questions can help manage that. So some of the ones that can be mentioned are cancer control, prevention, food security, complementary and integrative health, non-cigarette tobacco product use, and immunizations are all sponsored content examples. And then emerging content is new topics of growing interest that may be added, but they don't usually last more than a year, so it's usually like the newest stuff. And then the purpose of the survey is honestly very wide-ranging. So the data is used throughout the Department of Human and Health Services to monitor trends in illness and disability, but the data is also used by public health research communities and epidemiologic studies and policy analysis of health disparities, barriers to accessing and using care, measuring the effectiveness of federal health programs. Like, there's a lot of good stuff that can come from this data. And the intent is to serve as a reference point for other health-based studies, or like if there are specialized organizations who want to use this data to kind of like get funding, or to kind of show like this is an issue that needs to be addressed, like they have that data set to like look at. Yeah, from its creation, the survey has been designed to serve a diverse community of people throughout the U.S. rather than focusing on selected policies or program needs. So the impacts so far include playing a role in shaping the CDC's cervical cancer screening policy, monitoring 67 of the Healthy People 2010 objectives, allowed the Department of Health and Human Services to monitor health insurance coverage, which is kind of like an under talked about thing, I think, when it comes to health is like health insurance. Helping attract attention to arthritis as a public health problem, and has resulted in the first funding to the CDC for an arthritis program, and track the impact of influenza vaccines and delivery delays on receipt of influenza vaccinations among groups most at risk of influenza complications. So these are like important things that we are now able to track because of the survey. And that was the end. Thank you for watching. These are my references if you need them. So thanks.